Welcome to Ajit Bioacademy. Today I will talk about first pass metabolism or pre-systemic metabolism. Okay, so the first pass metabolism is very important for pharmacology. So today's topic is first pass metabolism, or you can say this is pre-systemic metabolism. So I will cover what is first pass metabolism, and is there any difference between first pass metabolism and pre-systemic metabolism? What is positive side of first pass metabolism, negative side of first pass metabolism, and finally we will discuss how we will overcome the first pass metabolism of a drug. Okay, so now firstly come to introduce the terminology first pass metabolism. So firstly you have to know metabolism. Metabolism means transformation from one molecule to another molecule. This is the biotransformation, that is the metabolism. But basically, the metabolism means metabolism and catabolism, but here first pass metabolism is basically considered as a catabolism, that is breakdown of drug. And why it is called first pass? So before going to discuss the first pass, I will just try to give you some details by drawing a picture, and then we will try to find out the differentiation, and then finally we will go for further activities. Okay, so firstly I will say first pass metabolism basically considered for oral administration. That means for oral route, when you will take drug orally, then first pass metabolism can be a matter of discussion. Okay, but sometimes for intranasal route, for rectal route, for peritoneal route, you can also consider first pass metabolism, although the first pass metabolism is very negligible. Okay, but possible. So if you say first pass metabolism is only possible for oral route, this is wrong statement, but you can say first pass metabolism is significantly important for oral administration or oral route. That would be the right terminology. Why? Now come to the details. So suppose you are taking a drug in oral route here, and then like that. Okay, so what would be the first pass? That means first encounter or first checkpoint you must meet when you take any drug orally. That means at the site of administration, the main destination is to go to systemic circulation. So before going to the systemic circulation, where a drug will encountered by particular point or particular organ or particular site. So now basically for oral route, from your from your stomach, from your intestine, large, smaller colon, even your upper rectum, drug will go to the portal vein. This is portal vein. Okay, here the superior inferior meningeal vein, the colic vein, different jejunal vein, different types of vein will collect the absorbed substances, and it will pass to the portal vein. Okay, and then it will go to a first checkpoint of your major checkpoint of your body, that is liver, and then it will go to the systemic circulation, our desired part. Okay, so actually from portal vein to liver, and then the hepatic vein, and then go to the inferior vena cava, then systemic circulation. Actually, this is systemic circulation. Okay, so most of the drugs or most of the oral route taking food, the final or desired molecule will absorb from that part and it will come to the blood stream. You can say these are the blood stream, or simply you can say blood or blood stream. Okay, so systemic circulation also the blood stream, but all the blood stream are not systemic circulation. So that would be the right terminology for here. That is blood or blood stream, not systemic circulation, because systemic circulation is there. So after absorption, drug will enter into the portal vein. Okay, this is called absorption. Sometimes drug can absorb directly to the systemic circulation for oral route. Suppose your sublingual route or buccal route, it will travel down to jugular vein, and then go to your subclavian vein, and then finally superior vena cava. Then heart. That means systemic circulation. Okay, from jugular vein directly it can bypass the liver. From intestine, some lacteal vessel, that means your lymphatic vessel, will collect some lipophilic substance and it will go to the inferior vena cava, that is systemic circulation. And this is called this is jugular vein and this is lymphatic system. Okay, so through jugular vein or sublingual route, you know the example of nitroglycerin. Nitroglycerin can directly enter into the systemic circulation. And for the lymphatic system, you know, the drug is basically can absorb directly to the systemic circulation by bypassing the liver. That is vitamin or fat soluble vitamin. You can say lipophilic substances can follow this pathway. Okay, so vitamin, vitamin A, D, E, K, these vitamins and some cyclosporin, different drugs can enter directly. And some drug can go to the systemic circulation through the peritoneal cavity. This is the lower abdominal part, the peritoneal fluid there, and from peritoneal cavity to directly systemic circulation. So this is the peritoneal cavity, and through this drug can enter into the systemic circulation. Okay, so for oral route, some drug can bypass the liver, but most of the food particle must go through the portal vein, must go through the liver, and then it will go to the systemic circulation. Okay, so when drug will absorb from the site of administration, it will go directly to the systemic circulation, or it will go to the bloodstream, or you can say blood. Okay, but this is called absorption. So absorption does not mean drug will go to the systemic circulation. So when drug will go to the systemic circulation, for a time being, that is called bioavailability. So when drug will just go from intestine or GI tract to portal vein, this is called absorption. Drug absorption. Okay, and then it will pass the liver, and if liver allow, then it will go to the systemic circulation. Okay, some exception is there. So now I will come to the point, first pass metabolism. So what would be the first pass? What would be the first encounter? What would be the first challenge? So that can be your gut. That can be your intestine. Your intestine has some enzyme, some environment which will just degrade the drug in a certain extent. Some drug can degrade, can metabolize within intestine. In that case, for those drugs, that can be the first pass. That is first encounter, first challenge. First challenge the drug failed to pass. Okay, this is the first pass. So we can go for some example. Which drugs will just metabolize in intestine. So those drugs are basically, midazolam. This is a sedative hypnotic drugs, and simvastatin. This is the lipid lowering drug. Uh, there's the philodipine. This is your calcium channel blocker. So those drugs can significantly metabolize in intestine. Basically, 40 to 50% can degrade within the GI tract. So in that case, you can say this is the pre-systemic metabolism. Means pre-systemic, that means before going to the systemic circulation, drug will metabolize. So in that case, you can precisely say it is pre-systemic metabolism. Okay, and now the most significant part is liver, which is the main metabolic organ, and this is the one of the major checkpoint for oral route any substances to reach to the systemic circulation. So there many drugs can significantly metabolized. Okay, so we can give some example for your liver metabolic drugs like propranolol, that is metoprolol, the atorvastatin, you can say verapamil, okay, you can say warfarin, different many of drugs. So even 70, 80 to 90% drug can metabolized in liver before going to the systemic circulation. So in that point, you can think like propranolol, it's 90% absorption. That means it will absorb 90% from GI tract and it will come to the portal vein and the liver. And within the liver, among 90%, 70%, 80% drug metabolized before reaching to the systemic circulation. Suppose if you take 100 milligram, then it will come to the liver 90 milligram, and among 90 milligram, 70% drug will metabolize. Okay, so only 25% drug, or you can say remaining 30% drug can enter into the systemic circulation. Okay, so where the metabolism happened? In liver. So liver is also the pre-systemic organ. So this is the pre-systemic metabolism, or precisely this is the significant organ. So you can say this is the main checkpoint. So this is real first pass. This is the real first encounter, real first checkpoint. So first pass metabolism basically considered when drug will metabolize in liver. Okay, so both are pre-systemic, but significantly you can consider first pass metabolism when drug will metabolize in liver. Okay, so this is basically the two terminology, first pass metabolism or pre-systemic metabolism. Both are same thing, but if you try to differentiate it, then you can consider first pass metabolism means when drug will metabolize in liver, and when drug will metabolize in intestine, you can consider as a pre-systemic metabolism. Both are pre-systemic metabolism. When drug will metabolize in intestine, you can consider also the first pass metabolism, because in the first encounter drug will degrade, but as liver is the major checkpoint. So in that case, first pass metabolism means you can consider liver metabolism. Okay, so this is all about the first pass metabolism and pre-systemic metabolism, and overall the layout of the drug molecules for reaching to the systemic circulation. Okay, so now I will talk about the positive side of first pass metabolism. Okay, so positive side, as it is basically considered as a negative, but why we will talk about the positive side of fast pass metabolism. Actually, fast pass metabolism is not our desired one. Actually, we have to just pass the drug to the systemic circulation. Okay, so what is the positive side of fast pass metabolism, or you can say advantages of fast pass metabolism? This is, the pro-drug concept. Some drugs must be metabolized into active form before reaching to the systemic circulation. Okay, so this is a pro-drug. So pro-drugs means, you have to take in inactive form, and then after reaching to the systemic circulation, it will be active. This is the concept. Okay, so some drug can be metabolized in liver, and that will be in active form, and then it will reach to the systemic circulation and go to the target organ. Okay, so the pro-drug example. So here, the enalapril that can convert into enalaprillate, and it will be active. You can consider as a morphine, you can consider as aspirin, and many drugs. But here, enalapril is one of the good example. Okay, so this is the pro-drug concept for the fast pass metabolism is basically considered here. And second one, that the detoxification. This is very important because the checkpoint is very important. When you take orally, everything will go to the blood, so your body will be vulnerable for that molecules. So this is the major metabolic organ, major checkpoint for oral administration. So that is detoxification. When you take any xenobiotics, any toxic substance, and according to the merit of the substance and nature of the substance, liver will degrade it or liver will pass it. Okay, so detoxification is very much important. For you can consider it as like paracetamol toxicity. Okay, so paracetamol overdose, or you will take more, then your liver will degrade it. Normally, the liver is a major metabolic organ for paracetamol. So not only paracetamol, if you take any toxic substance, and according to the nature or enzymatic reaction, liver will degrade it. So detoxification is very much important. Okay, another thing, your body will manage that according to the merit of the or chemical nature of the drug. So some less side effect management for fast pass metabolism. Your body will manage the drug concentration to the systemic circulation, that will maintain the side effect. Okay, so you can consider less side effect is one of the positive side. Okay, so these are the positive side of fast pass metabolism. Now come to the negative side. Basically, we consider that because this is a big challenge. If fast pass metabolism is highly significant, then you will not take that drug in oral route. So oral administration is not possible. This is the big challenge. So now for disadvantage. So disadvantage is that is your less bioavailability. When drug will be metabolized before systemic circulation, then the less bioavailability of drug, less extent of drug will reach to the systemic circulation, as those drugs will be metabolized in intestine or liver. Okay, so less chance to reach to the systemic circulation. So this is one of the big challenge, big problem. Okay, so second one is that when the drug will reach to the systemic circulation less extent, then is the effectiveness may vary. Okay, so this is another problem. So effectiveness can be a big problem. And third one is that you have to take more drug to give subsidy. Okay, suppose already I said propranolol, 10 milligram. So if it was free from systemic, pre-systemic or fast metabolism, then you need to take only 3 milligram, but you have to take now at 10 milligram. So that is the matter. That means you have to take more drug. That is the another negative side. Sometimes drug can interact with another drug, and that can convert into another form, and it can change the effectiveness of other drug. So that is another problem, like rifampicin or rifampin. This is that anti-tubercular drug can decrease the effectiveness of OCP, that is oral contraceptive pill. So this is actually the drug-drug interaction, but not directly connected to the pre-systemic or fast metabolism, but it's happening before reaching to the systemic circulation. So you can consider it in that way. Okay, so negative side is more. So these are the negative or disadvantages of fast metabolism. So now our main one of the point to discuss, that is how to overcome the fast metabolism. How to overcome the fast metabolism. So this is one of the big challenge. That is, you have to change the route. You are taking oral administration and your checkpoint just stop the drug or degrade the drug. So you will not go to that route. You have to change the route to reach your destination. So this is the way. So basically, IV, IM, or inhalation, or you can say pulmonary route, or you can say in rectal route, you will just avoid the fast metabolism. Although intranasal, peritoneal, upper rectal route, or you can say lymphatic route, some extent drug can degrade. That means in some extent drug can be metabolized as a pre-systemic or fast metabolism. But mostly you can avoid. When you will take sublingual, you will take IV, IM in that route. So that would be the way to overcome the fast metabolism. Secondly, you have to give subsidy. You have to increase the dose. That means how much amount of drug will degrade, that much amount of drug you have to take more. That is the simple equation. Okay, this is another way to overcome the problems. Another one, you can go for pro-drug concept. Suppose some drug is just degrading in the intestine, so you can take in inactive form, and that will just go to the blood, and then it will be active. So that would be the another way. And you can think for formulation change. Okay, like you can go for enteric coating, you can go for nanotechnology or liposome neosome technology that will follow the lymphatic pathway, that is directly to the thoracic duct, to the directly your superior vena cava and then systemic circulation. Okay, so in different way you can overcome the fast metabolism or pre-systemic metabolism. Okay, so now I will sum up. That is, fast metabolism or pre-systemic metabolism, in a true sense both are similar terminology, but as the first pass, that is main checkpoint, is liver, so fast pass metabolism is basically considered for liver metabolism, but you can consider also in intestinal metabolism, and precisely you can say pre-systemic metabolism, as a metabolism is just happening before systemic circulation, that is liver or intestine, the major two part. Okay, so this is all about for today. If you have any question, then you can ask me in comment box, and if you think this video is helpful for you, so you can share or you can comment. Thank you very much.